Welcome to another episode of Medicine Simplified. In this video, we will know about dumping syndrome. Dumping syndrome is postprandial disorder caused by rapid gastric emptying or too large quantity reaching the small intestine. Commonly seen in patients undergoing partial or total gastrectomy or peptic ulcer disease. Disruption of normal gastric emptying and neurohormonal regulation leads to rapid delivery of nutrients into small intestine. Under normal circumstances, the release of nutrients from stomach to duodenum is regulated by multiple homeostasis mechanisms, which include pyloric tone, antral contractions, proximal stomach distensibility, and negative feedback from duodenal nutrient sensing. Sensory motor signals from vagus nerve, as well as various gastrointestinal hormones, help coordinate these homeostatic mechanisms. Surgical interventions involving stomach and esophagus can alter these processes and lead to dumping syndrome. Coming to the classification of dumping syndrome, classified into two types depending on relation of symptoms to time elapsed after a meal. First one is early dumping syndrome. Symptoms of early dumping occurs within 10 to 30 minutes after a meal. Second type is late dumping syndrome. Symptoms are observed after 1 or 3 hours after a meal. Coming to the pathophysiology, alterations of gastric anatomy by surgery, including resection or bypass of pylorus and interference with gastric innervations. The accommodation and cyclic contractility of stomach in response to distension are abolished after partial gastrectomy, allowing immediate dumping of gastric content into jejunum. Gastric emptying is under control by funding tone, antropyloric mechanism, and duodenal feedback, regulated by enteric nervous system and circulating J hormones. Disruption in neurohormonal homeostasis can lead to dumping syndrome. The release of several gastrointestinal and vasoactive agents like glucagon-like peptide GLP-1, peptide YY, insulin, glucagon, and glucose-dependent insulinotropic peptide is also believed to be involved in pathophysiology of early dumping syndrome. Coming to the surgical causes, gastrectomy, surgery to remove part or all of stomach. Bariatric surgery, surgery for weight loss such as gastric bypass. Pyloroplasty, an operation on pyloric valve at bottom of stomach. Esophagectomy, surgery to remove part or all of esophagus. Vagotomy, surgery to cut the vagus nerve in stomach to reduce stomach acid. Nissen fundoplication, surgery to sew the top of stomach around the esophagus. Coming to the symptoms, early dumping syndrome symptoms include vasoactive symptoms like increased bowel sounds, diarrhea, bloating, nausea, and abdominal pain. Gastrointestinal symptoms include fatigue, flushing, palpitations, hypotension, rarely syncope, perspiration. Late dumping syndrome symptoms. Pathogenesis of late dumping symptoms is believed to be due to hypoglycemia, arising from hyperinsulinemia, response to hyperglycemia noted in early dumping phase. Vagal sympathetic activation symptoms include syncope, hunger, confusion, weakness, and fatigue. Neuroglycopenia symptoms include perspiration, palpitations, irritability, and tremors. Coming to the evaluation of dumping syndrome, SIGSTAT developed a diagnostic index for dumping syndrome that incorporate multiple clinical signs and symptoms. A total score greater than 7 supports a diagnosis of dumping syndrome, which include pre-shock or shock +5, loss of consciousness or fainting +4, will lie down or sit +4, dyspnea +3, physical fatigue or exhaustion +3, sleep, listlessness, blurred vision +3, palpitation +3, restlessness or agitation +2, dizziness or vertigo +2, headache +1, feeling hot, sweating, paleness, clammy skin +1, nausea +1, abdominal distension and meteorism +1, Borbigan +1, fractation -1, vomiting -4. If you get score greater than 7, supports diagnosis of dumping syndrome. Other tests to conclude the diagnosis of dumping syndrome include oral glucose tolerance test, blood glucose, pulse rate, hematocrit measurements. Test results support early dumping when hematocrit rises by more than 3% or pulse rate increases by more than 10 beats per minute at 30 minutes. Coming to the treatment and management of dumping syndrome, treatment options for dumping syndrome include dietary modifications, pharmacological agents, and surgical interventions. Coming to the dietary modifications, reducing the amount of food ingested at every meal, postponing fluid intake at least 30 minutes after meals, which can help in minimizing early dumping by limiting initial gastric emptying of fluid component. Elimination of rapidly absorbable carbohydrates helps reduce late dumping. Consuming foods rich in fiber and protein. Eating slowly and chewing food well. Lying down for 30 minutes after meals to reduce symptoms of hypovolemia. Dietary viscosity enhancing agents are good second-line treatment. Increased meal viscosity slows the release of nutrients into small intestine. Pharmacological therapy. Acarbose functions as alpha-glycosidase inhibitor that delays the breakdown and absorption of carbohydrates, which decreases incidence of hypoglycemia. Somatostatin analogs offer therapeutic benefits for both early and late dumping syndrome through multiple mechanisms. Disoxide acts as potassium channel activator that suppresses calcium-induced insulin release, thereby reducing hypoglycemia associated with late dumping syndrome. If you like this video, please subscribe to our channel. Thank you.